Medical Assistant Final Exam Review. Question 1. A medical assistant reviews a case where a used venipuncture needle is ready for disposal while communicating with the care team. Which practice is safest? Option A. Break the needle before disposal. Option B. Place it in a coat pocket until the room is cleaned. Option C. Recap with both hands to prevent leakage. Option D. Avoid recapping and dispose of it immediately in a sharps container. The correct answer is option D. Avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 2. For a patient asking for clarification in an outpatient setting, an exam room is being disinfected between patients for a patient asking for clarification. Which workflow is most appropriate? Option A. Clean from less contaminated areas toward more contaminated areas. Option B. Use the same wipe until it is visibly dry and dirty. Option C is start with the trash and then clean the clean supplies. Option D. Disinfect only areas the patient mentions touching. The correct answer is option A. Clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 3. During a skills check, the scenario states that a coagulation study such as patient or INR is ordered. Which tube is typically used? Option A. Light blue sodium citrate tube. Option B. Yellow acid citrate dextrose tube. Option C. Gray sodium fluoride tube. Option D. Lavender EDTA tube. The correct answer is option A. Light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 4. A medical assistant reviews a case where a complete blood count is ordered for a patient while preparing for provider review. Which tube is most appropriate? Option A. Lavender EDTA tube. Option B. Plain urine cup. Option C. Light blue citrate tube. Option D. Gray fluoride tube. The correct answer is option A. Lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC. Question 5. A provider asks for assistance because a tourniquet has been applied while locating a vein for a patient scheduled for a procedure. Which practice helps prevent hemoconcentration? Option A. Tighten it after blood begins flowing. Option B. Apply it over broken skin for grip. Option C. Leave it on until all paperwork is complete. Option D. Release the tourniquet within about 1 minute when possible. The correct answer is option D. Release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 6. When preparing safe patient care, a vein tends to roll during palpation. Which action can improve venipuncture control? Option A. Tap the needle against the vein repeatedly. Option B. Use the thumb above the puncture site. Option C. Anchor the vein by pulling the skin taut below the site. Option D. Ask the patient to pump the fist throughout the draw. The correct answer is option C. Anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 7. While reviewing office protocol, an additive tube has just filled during venipuncture after reviewing the order. Which action is appropriate? Option A. Set it aside without mixing. Option B. Shake it hard until foam appears. Option C. Open the tube and stir it with a swab. Option D. Invert the tube gently the recommended number of times. The correct answer is option D. Invert the tube gently the recommended number of times. Additive tubes need gentle inversion to mix blood with the additive and prevent clotting or testing errors. Shaking, failing to mix, or opening tubes creates specimen problems and exposure risk. Question 8. In a medical assistant certification review scenario, a urine drug screen requires legal chain of custody handling for a patient with diabetes. Which action is essential? Option A. Document specimen control and signatures at each transfer. Option B. Use a routine sticky note instead of required forms. Option C. Let the patient take the specimen home overnight. Option D. Leave the specimen unlabeled in the bathroom. The correct answer is option A. Document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 9. A provider asks for assistance because a patient says they are scared about a biopsy result. Which response is therapeutic? Option A. I know for sure nothing is wrong. Option B. That sounds frightening. I can let the provider know you have concerns. Option C. Everyone gets scared, so stop worrying. Option D. You should not ask questions. The correct answer is option B. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 10. At a preventive care appointment, a patient with limited mobility is involved when a patient asks what hemoglobin A1C reflects during a high-yield exam review. Which explanation is most accurate? Option A. White blood cell count after infection. Option B. Kidney function during the last hour. Option C. Average blood glucose control over roughly the past 2 to 3 months. Option D. Blood oxygen level at this exact moment. The correct answer is option C. Average blood glucose control over roughly the past 2 to 3 months. Hemoglobin A1C reflects long-term glucose exposure over the lifespan of red blood cells. It is not a real-time oxygen, kidney, or white blood cell measurement. Question 11. For a teen patient in an outpatient setting, a throat culture is being collected for suspected strep throat for a teen patient. Which technique is appropriate? Option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. Option B. Touch the swab to the tongue repeatedly. Option C. Swab only the outer lips. Option D. Dip the swab in tap water before collection. The correct answer is option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue and cheeks. The tonsillar area and posterior pharynx are the target sites for a throat culture. Swabbing lips, contaminating with tongue contact, or adding tap water can reduce specimen quality. Question 12. For a patient with a routine complaint in an outpatient setting, a capillary puncture is needed for an adult patient. Which site is generally preferred? Option A. The side of the distal segment of the middle or ring finger. Option B. The center of the thumb pad. Option C. A swollen infected fingertip. Option D. The earlobe for every adult test. The correct answer is option A. The side of the distal segment of the middle or ring finger. The side of the distal middle or ring finger is commonly used because it provides blood flow while reducing injury risk. Thumb punctures, routine earlobe use, and infected sites are not preferred for standard adult finger sticks. Question 13. After confirming the patient's identity, a tube label and requisition do not match while preventing documentation errors. Which action is most appropriate? Option A. Guess which name is correct. Option B. Stop processing and resolve the discrepancy according to policy. Option C. Scratch out the name and keep going. Option D. Send it to the lab without comment. The correct answer is option B. Stop processing and resolve the discrepancy according to policy. Label and requisition mismatches create serious patient identification risk and must be resolved before processing. Guessing, altering labels casually, or sending the specimen without correction can produce dangerous errors. Question 14. When preparing safe patient care, a patient wants lab results through an online system for a patient who appears anxious. Which feature supports secure access? Option A. A patient portal with identity verification and secure messaging. Option B. A public social media comment. Option C. A hallway bulletin board. Option D. A group text to unrelated patients. The correct answer is option A. A patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 15. While following clinic policy, the medical assistant notes that a 12-lead EKG is being set up before the patient leaves the clinic. Where is lead V1 placed? Option A, fourth intercostal space at the right sternal border. Option B, second intercostal space at the left midclavicular line. Option C, fifth intercostal space at the left anterior axillary line. Option D, on the right wrist beside the limb lead. The correct answer is option A, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 16. A provider asks for assistance because a medical assistant is locating the V4 chest lead for a patient who appears anxious. Which landmark is correct? Option A, second rib at the right axillary line. Option B, left wrist below the thumb. Option C, fifth intercostal space at the left midclavicular line. Option D, a fourth intercostal space at the right sternal border. The correct answer is option C, fifth intercostal space at the left midclavicular line. V4 is placed in the fifth intercostal space at the left midclavicular line. The other choices describe V1, a limb lead area, or an incorrect thoracic location. Question 17. While assisting with patient care, a patient with a routine complaint is involved when a urine drug screen requires legal chain of custody handling while communicating with the care team. Which action is essential? Option A, let the patient take the specimen home overnight. Option B, use a routine sticky note instead of required forms. Option C, document specimen control and signatures at each transfer. Option D, leave the specimen unlabeled in the bathroom. The correct answer is option C, document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 18. A provider asks for assistance because a patient reports new chest pain while an EKG is being recorded for a new patient. Which action should the medical assistant take? Option A, erase the tracing because pain changes results. Option B, finish filing old charts before reporting. Option C, notify the provider immediately according to emergency protocol. Option D, tell the patient to drive home and rest. The correct answer is option C, notify the provider immediately according to emergency protocol. New chest pain can represent an urgent cardiac concern and should be escalated immediately. Delaying, advising the patient to drive, or deleting clinical information can endanger the patient. Question 19. A medical assistant reviews a case where a 12-lead EKG requires limb electrodes after confirming office policy. Which label belongs on the right arm area? Option A, V4. Option B, RA. Option C, LA. Option D, LL. The correct answer is option B, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 20. While following clinic policy, the medical assistant notes that the EKG pattern looks unusual and limb lead placement may have been reversed for a patient waiting for the provider. Which action is appropriate? Option A, check lead placement before repeating or submitting the tracing. Option B, remove the patient's identification label. Option C, submit it without comment because lead placement never matters. Option D, change the printed rhythm interpretation manually. The correct answer is option A, check lead placement before repeating or submitting the tracing. Incorrect lead placement can produce misleading tracings, so verifying lead location is part of quality practice. Submitting without checking, removing identification, or altering interpretation manually is unsafe. Question 21. When preparing safe patient care, a blood specimen label is about to be placed on a tube. Which action best prevents patient identification errors? Option A, ask another patient to confirm the name. Option B, label the tube after returning to the desk. Option C, use the room number as the only identifier. Option D, verify two identifiers such as full name and date of birth before labeling. The correct answer is option D, Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 22. While following clinic policy, the medical assistant notes that a patient is scheduled for an antibiotic injection before the patient leaves the clinic. Which step is essential before administration? Option A. Assume no allergy if the patient is young. Option B. Ask only whether the patient likes injections. Option C. Ask about allergies and check the record for documented reactions. Option D. Give half the dose without checking. The correct answer is option C. Ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 23. While following clinic policy, the medical assistant notes that a medication is ordered by the subcutaneous route for a patient with hypertension. Where is the medication intended to be placed? Option A. Into the spinal canal. Option B. Into the fatty tissue beneath the skin. Option C. Into the outer layer of bone. Option D. Directly into a vein. The correct answer is option B. Into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 24. A provider asks for assistance because insulin is prescribed in units while preparing for provider review. Which equipment is appropriate for measuring it? Option A. An insulin syringe calibrated in units. Option B. A household teaspoon. Option C. A medicine cup for tablets. Option D. A tuberculin syringe marked only in milliliters without conversion. The correct answer is option A. An insulin syringe calibrated in units. Insulin syringes are specifically calibrated in units to match insulin dosing. Household spoons, unconverted milliliter markings, and tablet cups do not provide safe insulin measurement. Question 25. In a medical assistant certification review scenario, a patient has written instructions about future medical care if unable to speak for a pediatric patient. Which document is this? Option A. Advanced directive. Option B. Daily deposit slip. Option C. Autoclave indicator. Option D. Super bill. The correct answer is option A. Advanced directive. An advanced directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 26. For a patient with a routine complaint in an outpatient setting, a patient taking furosemide asks why urination has increased. Which explanation is most accurate? Option A. Diuretics help the body remove excess fluid through urine. Option B. Diuretics are used only for pain relief. Option C. Diuretics stop kidney filtration completely. Option D. Diuretics are vaccines against infection. The correct answer is option A. Diuretics help the body remove excess fluid through urine. Furosemide is a diuretic that increases fluid and electrolyte excretion through the kidneys. It does not stop filtration, function as a vaccine, or serve only as an analgesic. Question 27. After confirming the patient's identity, a patient develops hives, wheezing, and throat tightness after an injection while following standard precautions. Which emergency medication may be indicated by protocol? Option A. Oral iron only. Option B. Topical sunscreen. Option C. Epinephrine. Option D. Routine multivitamin. The correct answer is option C. Epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 28. During a certification-style scenario, a handwritten order uses the abbreviation U for units for a patient with diabetes. Which action is safest? Option A. Ignore the abbreviation and give any dose. Option B. Assume U means unlimited refills. Option C. Change it to milligrams without asking. Option D. Clarify the order because you can be misread. The correct answer is option D. Clarify the order because you can be misread. The abbreviation U can be mistaken for a 0 or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 29. When preparing safe patient care, a patient asks whether to stop an antibiotic once symptoms improve. Which instruction is generally appropriate? Option A, double the next dose to finish faster. Option B, save the rest for a family member. Option C, stop immediately when feeling better every time. Option D, follow the prescribed course and contact the provider before stopping early. The correct answer is option D. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 30. During a skills check, the scenario states that an insurance plan states the patient must pay a set amount before coverage begins during the visit. Which term applies? Option A, deductible. Option B, consent form. Option C, contraindication. Option D, copayment. The correct answer is option A, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 31. In a medical assistant certification review scenario, a vaccine is administered in the clinic for a returning patient. Which detail should be documented? Option A, only the patient's favorite pharmacy. Option B, vaccine name, lot number, expiration date, site, route, and patient response is required. Option C, a guess at the manufacturer if the label is missing. Option D, the weather outside the clinic. The correct answer is option B. Vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 32. While reviewing office protocol, a patient in the exam room is involved when a provider describes a patient's heart rate as bradycardic. What does this mean? Option A, faster than normal heart rate. Option B, slower than normal heart rate. Option C, high blood sugar. Option D, absent breathing. The correct answer is option B, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 33. For a teen patient in an outpatient setting, a patient's blood glucose is described as hyperglycemic during the visit. What does the prefix hyper indicate? Option A, high or excessive. Option B, below normal. Option C, without pain. Option D, around the heart. The correct answer is option A, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 34. A provider asks for assistance because a chart lists hypertension as a chronic condition for an older adult. Which finding is associated with this diagnosis? Option A, low blood oxygen only. Option B, persistently elevated blood pressure. Option C, inflamed tonsils. Option D, low body temperature. The correct answer is option B, persistently elevated blood pressure. Hypertension refers to blood pressure that remains elevated over time. Oxygen saturation, tonsil inflammation, and temperature changes describe different clinical problems. Question 35. A medical assistant reviews a case where a patient asks what the kidneys do before the patient leaves the clinic. Which response is accurate? Option A, filter waste from blood and help regulate fluid balance. Option B, exchange oxygen in the alveoli. Option C, produce bile for fat digestion. Option D, pump blood through arteries. The correct answer is option A, filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 36. During a morning clinic session, a study question asks about bile production for an adult patient. Which organ is primarily responsible? Option A, bladder. Option B, the adrenal gland. Option C, liver. Option D, appendix. The correct answer is option C, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 37. For a patient in the exam room in an outpatient setting, a medication note refers to hypotension. What does hypo mean? Option A, before birth. Option B, between ribs. Option C, above normal. Option D, below normal or low. The correct answer is option D, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 38. In a medical assistant certification review scenario, a patient describes dysuria after confirming office policy. What does dys usually indicate? Option A, normal. Option B, difficult or painful. Option C, after meals. Option D, without. The correct answer is option B, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 39. A medical assistant reviews a case where a small blood spill occurs on an exam room floor for a patient with hypertension. Which action should be included? Option A, clean it with a dry tissue only. Option B, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option C, cover it with paper and leave it for housekeeping tomorrow. Option D, ask a visitor to wipe it up. The correct answer is option B, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 40. In a medical assistant certification review scenario, an anatomy diagram divides the body into left and right portions. Which plane is shown? Option A, sagittal plane. Option B, the oblique medication route. Option C, transverse plane. Option D, the frontal plane. The correct answer is option A, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back. And oblique medication route is not an anatomical plane. Question 41. A provider asks for assistance because a patient is lying face down on the exam table while working under provider supervision. Which term describes this position? Option A, supine. Option B, Fowler. Option C, Trendelenburg. Option D, a prone. The correct answer is option D, prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 42. For a patient asking for clarification in an outpatient setting, a patient has fatigue, cold intolerance, and weight gain with low thyroid activity for a patient asking for clarification. Which condition is suggested? Option A, hyperventilation. Option B, tachycardia only. Option C, hypothyroidism. Option D, otitis media. The correct answer is option C, hypothyroidism. Hypothyroidism reflects reduced thyroid hormone activity and can slow metabolism. Hyperventilation, middle ear infection, and fast heart rate do not match the low thyroid pattern described. Question 43. When preparing safe patient care, a patient with limited English proficiency needs discharge teaching while supporting safe patient care. Which approach is best? Option A, speak louder in English only. Option B, use a qualified medical interpreter according to policy. Option C, ask a young child to interpret sensitive information. Option D, skip teaching because interpretation takes time. The correct answer is option B, use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 44. A medical assistant reviews a case where an insurance plan must approve a medication before it is dispensed for a patient asking for clarification. What process is being requested? Option A, waive scheduling. Option B, coinsurance posting. Option C, prior authorization. Option D, alphabetic indexing. The correct answer is option C, Prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 45. When preparing safe patient care, a patient receives a statement from insurance showing allowed charges and payments. What is this document called? Option A, Incident Report. Option B, Prescription Label. Option C, Advance Directive. Option D, Explanation of Benefits. The correct answer is Option D, Explanation of Benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advance directives, incident reports, and prescription labels serve different purposes. Question 46. A medical assistant reviews a case where an insurance plan states the patient must pay a set amount before coverage begins while working under provider supervision. Which term applies? Option A, consent form. Option B, deductible. Option C, copayment. Option D, contraindication. The correct answer is Option B, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 47. When preparing safe patient care, a claim needs a code for the patient's diagnosis for an older adult. Which code set is used? Option A, NDC only. Option B, CPT only. Option C, YCD-10-CM. Option D, HCPCS Level 2 only. The correct answer is Option C, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 48. During a skills check, the scenario states that a medical office submits a professional paper claim during a high-yield exam review. Which form is traditionally used? Option A, fire extinguisher tag. Option B, growth chart. Option C, W-4 tax withholding form. Option D, CMS 1500. The correct answer is Option D, CMS 1500. The CMS 1500 is the standard paper professional claim form. Tax, safety, and growth documents are unrelated to claim submission. Question 49. A provider asks for assistance because Medicare may not cover a service and the patient must be informed before it is performed for a teen patient. Which form may be needed? Option A, daily appointment reminder card. Option B, pediatric growth chart. Option C, advanced beneficiary notice. Option D, bloodborne pathogen log. The correct answer is Option C, advanced beneficiary notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 50. After confirming the patient's identity, paper charts are filed alphabetically after the patient asks a follow-up question. Which name is usually used first? Option A, favorite color. Option B, appointment room number. Option C, patient's last name. Option D, street number only. The correct answer is Option C, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 51. A medical assistant reviews a case where a conscious adult cannot speak or cough effectively while choking for an older adult. Which first aid action is commonly used? Option A, abdominal thrusts according to training. Option B, offer a large meal. Option C, insert a blind finger sweep. Option D, tell the patient to lie flat and sleep. The correct answer is Option A, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 52. After confirming the patient's identity, a patient misses a scheduled appointment without canceling. Which action is appropriate? Option A, document the no-show and follow office policy for follow-up. Option B, bill any random amount without policy. Option C, discuss the patient publicly in the waiting room. Option D, delete the appointment from the record. The correct answer is Option A, Document the no-show and follow office policy for follow-up. No-shows should be documented and handled consistently according to office policy. Deleting records, arbitrary billing, or public discussion creates administrative and privacy problems. Question 53. When preparing safe patient care, a patient requests correction of information in the medical record after the patient asks a follow-up question. Which action is appropriate? Option A. Tell the patient records can never be reviewed. Option B. Follow the facility process for an amendment or addendum. Option C. Change another patient's chart instead. Option D. Erase the original entry without documentation. The correct answer is option B. Follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 54. While training a new medical assistant, a billing call is made about an overdue balance for a pediatric patient. Which practice protects privacy? Option A. Leave detailed diagnosis information on a shared voicemail. Option B. Verify the patient's identity before discussing account details. Option C. Announce the debt in the waiting room. Option D. Discuss the balance with anyone who answers. The correct answer is option B. Verify the patient's identity before discussing account details. Identity verification helps protect financial and health information during billing conversations. Sharing details with unknown persons, detailed shared voicemail, or public announcements violates privacy. Question 55. After confirming the patient's identity, a patient is cold and shivering during an EKG while preparing for provider review. Which artifact is most likely? Option A. A normal calibration mark only. Option B. A blood pressure cuff leak. Option C. A guaranteed myocardial infarction. Option D. Muscle artifact that makes the tracing appear noisy. The correct answer is option D. Muscle artifact that makes the tracing appear noisy. Shivering creates muscle activity that can make the tracing noisy and difficult to interpret. It should not be assumed to be a heart attack, a cuff problem, or only a calibration mark. Question 56. In an outpatient medical office, a patient with diabetes is involved when a staff member fails to follow a safety policy and a patient is injured as a result for a patient with diabetes. Which concept is involved? Option A. Therapeutic communication only. Option B. Negligence. Option C. Autoclaving. Option D. Coinsurance. The correct answer is option B. Negligence. Negligence involves a breach of duty that contributes to harm. Sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 57. Before the provider enters the room, a patient has written instructions about future medical care if unable to speak during a quality control check. Which document is this? Option A. Autoclave indicator. Option B. Daily deposit slip. Option C. Superbill. Option D. Advance directive. The correct answer is option D. Advance directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 58. During a skills check, the scenario states that a patient uses a traditional health practice unfamiliar to the medical assistant for a patient with a routine complaint. Which response is best? Option A. Tell the patient to stop without provider input. Option B. Ignore it even if it may affect care. Option C. Ridicule the practice in the chart. Option D. Ask respectful, non-judgmental questions and share relevant information with the provider. The correct answer is option D. Ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 59. While following clinic policy, the medical assistant notes that an exam room is being disinfected between patients. Which workflow is most appropriate? Option A. Clean from less contaminated areas toward more contaminated areas. Option B. Disinfect only areas the patient mentions touching. Option C. Use the same wipe until it is visibly dry and dirty. Option D is start with the trash and then clean the clean supplies. The correct answer is option A. Clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 60. In a medical assistant certification review scenario, a patient says they are scared about a biopsy result while preparing for provider review. Which response is therapeutic? Option A. I know for sure nothing is wrong. Option B. That sounds frightening. I can let the provider know you have concerns. Option C. Everyone gets scared, so stop worrying. Option D. You should not ask questions. The correct answer is option B. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 61. During a skills check, the scenario states that a medical assistant reports a patient concern to the provider using SPAR for an older adult. What does the S represent? Option A, supine. Option B, sterilization. Option C, situation. Option D, superbill. The correct answer is option C, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 62. While following clinic policy, the medical assistant notes that a medical assistant acts to promote the patient's welfare while preparing for provider review. Which ethical principle is demonstrated? Option A, maleficence. Option B, beneficence. Option C, deposition. Option D, fraud. The correct answer is option B, beneficence. Beneficence means acting for the benefit and welfare of the patient. Maleficence, fraud, and deposition describe harm, deception, or legal testimony rather than doing good. Question 63. After confirming the patient's identity, a patient reports a severe latex allergy before rooming for a patient in the exam room. Which action is appropriate? Option A, use powdered latex gloves for a better fit. Option B, use latex-free supplies and alert the care team. Option C, ignore the report unless a rash is visible. Option D, document the allergy only after the visit. The correct answer is option B, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 64. A provider asks for assistance because a patient becomes angry about a long wait while communicating with the care team. Which response is best? Option A, mock the patient's concern. Option B, argue loudly in front of other patients. Option C, use a calm voice, acknowledge the frustration, and offer to check the status. Option D, threaten to cancel care immediately without policy. The correct answer is option C. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 65. At the front desk handoff, a patient in the exam room is involved when a patient feels faint after a blood draw for a patient in the exam room. Which action is appropriate? Option A, tell the patient to run outside for air. Option B, help the patient lie down safely and notify the provider as needed. Option C, give insulin without checking blood glucose. Option D, leave the patient alone in the chair. The correct answer is option B, help the patient lie down safely and notify the provider as needed. A faint patient should be protected from falling and assessed according to protocol. Running, leaving the patient alone, or giving unrelated medication can create harm. Question 66. For a patient waiting for the provider in an outpatient setting, a conscious diabetic patient is shaky and has a low glucose reading. Which action is generally appropriate by protocol? Option A, give nothing and send the patient to drive home. Option B, tell the patient to exercise vigorously. Option C, administer a random antibiotic. Option D, provide a fast-acting carbohydrate if allowed by office policy. The correct answer is option D, Provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 67. While following clinic policy, the medical assistant notes that a patient is using a nebulizer treatment in the office while preventing documentation errors. Which instruction is appropriate? Option A, turn the machine off whenever mist appears. Option B, breathe normally through the mouthpiece or mask as directed until treatment is complete. Option C, share the mouthpiece with another patient. Option D, drink the medication from the cup. The correct answer is option B. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 68. For a new patient in an outpatient setting, a patient twists an ankle in the parking lot for a new patient. Which first aid concept may be used initially? Option A, ignore swelling until next year. Option B, heat, running, and deep massage immediately. Option C, rest, ice, compression, and elevation as appropriate. Option D, sterilize the ankle in an autoclave. The correct answer is option C, rest, ice, compression, and elevation as appropriate. Initial sprain care often uses rest, ice, compression, and elevation to reduce swelling and protect the area. Heat, running, ignoring symptoms, or autoclaving are inappropriate. Question 69. While following clinic policy, the medical assistant notes that a patient is pale, cool, clammy, and confused after an injury. Which condition is a concern? Option A, myopia. Option B, shock. Option C, otitis externa. Option D, back knee. The correct answer is option B, shock. Pale cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 70. During a skills check, the scenario states that an AED is available for an unresponsive patient with no normal breathing while preparing for provider review. Which action is appropriate? Option A, place the pads over thick clothing. Option B, use the AED only after the clinic closes. Option C, ignore the AED because it gives instructions. Option D, turn on the AED and follow its prompts while continuing emergency response. The correct answer is option D, turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 71. At a pediatric visit, a patient with hypertension is involved when a disinfectant splashes into a staff member's eye for a patient with hypertension. Which first response is appropriate? Option A, use hand sanitizer in the eye. Option B, cover it and wait until tomorrow. Option C, flush the eye with water or eye wash for the recommended time and report the exposure. Option D, rub the eye hard to remove chemical. The correct answer is option C, flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 72. When preparing safe patient care, a patient is scheduled for a minor office procedure while supporting safe patient care. Which role may the medical assistant perform? Option A, explain all surgical risks independently. Option B, sign the consent for the patient. Option C, witness the patient's signature after the provider obtains consent if office policy allows. Option D, perform the procedure without provider involvement. The correct answer is option C, witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 73. At a pediatric visit, a provider asks the medical assistant to prepare for suture removal for a patient with limited mobility. Which supply is commonly needed? Option A, a meal tray. Option B, sterile suture removal scissors or a sterile blade with forceps according to policy. Option C, a urine culture cup only. Option D, a blood pressure cuff only. The correct answer is option B, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 74. A medical assistant reviews a case where a patient has a small foreign material exposure in the eye. Which action is appropriate before irrigation? Option A, ignore contact lenses and begin forcefully. Option B, apply random medication drops without order. Option C, check the order or protocol and use appropriate solution and protection. Option D, use a dry cotton swab across the cornea. The correct answer is option C, check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 75. Before the provider enters the room, a patient is using a nebulizer treatment in the office during the visit. Which instruction is appropriate? Option A, turn the machine off whenever mist appears. Option B, share the mouthpiece with another patient. Option C, drink the medication from the cup. Option D, breathe normally through the mouthpiece or mask as directed until treatment is complete. The correct answer is option D, breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 76. In a medical assistant certification review scenario, a patient receives new wound care instructions for a teen patient. Which method checks understanding? Option A, ask only whether the patient owns a phone. Option B, ask the patient to explain the steps in their own words. Option C, give instructions as quickly as possible and leave. Option D, assume silence means full understanding. The correct answer is option B, ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 77. A medical assistant reviews a case where a patient asks detailed questions about a new diagnosis after noticing a potential safety concern. Which action is appropriate for the medical assistant? Option A, provide approved educational materials and refer diagnosis questions to the provider. Option B, create a personal treatment plan without provider input. Option C, tell the patient not to research anything. Option D, change the diagnosis in the chart. The correct answer is option A, provide approved educational materials and refer diagnosis questions to the provider. Medical assistants can reinforce approved education but should refer diagnosis and treatment decisions to the provider. Independent treatment planning, discouraging questions, or changing diagnoses exceeds the role. Question 78. When preparing safe patient care, a warm compress is ordered for a localized muscle strain for an adult patient. Which action supports safety? Option A, place it over a medication patch. Option B, use heat over numb skin without monitoring. Option C, apply maximum heat to speed healing. Option D, check temperature and skin condition before and during application. The correct answer is option D, check temperature and skin condition before and during application. Heat therapy requires temperature checks and skin monitoring to prevent burns. Excessive heat, numb skin without monitoring, or use over patches can cause injury or alter medication absorption. Question 79. At a provider-requested assessment, a patient has been rushing and sits down for a routine blood pressure measurement. Which step should occur before recording the value? Option A, allow the patient to sit quietly with the arm supported at heart level. Option B, record the value immediately to avoid delay. Option C, ask the patient to stand for the first reading. Option D, place the arm above the head to relax the vessels. The correct answer is option A, allow the patient to sit quietly with the arm supported at heart level. Resting quietly with the arm supported at heart level reduces temporary changes caused by activity and position. Standing unnecessarily, elevating the arm above the head, or recording immediately after exertion can make the reading unreliable. Question 80. When preparing safe patient care, adult CPR is started according to current basic life support guidance after reviewing the order. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 1 compression every 5 minutes. Option C, 100 to 120 compressions per minute. Option D, 10 to 20 compressions per minute. The correct answer is option C, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 81. During a skills check, the scenario states that a pulse oximeter is not giving a steady reading on a patient with cold fingers for a patient waiting for the provider. Which action should the medical assistant try first? Option A, apply the sensor over dark nail polish without adjustment. Option B, place the probe on a moving hand during conversation. Option C, warm the finger and ensure the sensor is positioned correctly. Option D, ignore the reading because pulse oximetry is optional. The correct answer is option C, warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 82. During a skills check, the scenario states that an adult patient is asked to rate pain during intake during the visit. Which documentation is most appropriate? Option A, no pain score needed because vital signs are normal. Option B, patient probably exaggerates pain. Option C, pain is bad because the patient looks uncomfortable. Option D, pain level of 7 on a 0 to 10 scale with location and quality. The correct answer is option D, pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 83. During an annual wellness visit, a patient says, "I feel pressure in my chest after climbing stairs," for a patient with limited mobility. How should the information be documented? Option A, change the wording to make it sound less serious. Option B, document it as a confirmed diagnosis of angina. Option C, leave it out unless the provider hears it directly. Option D, record the statement as subjective data in the patient's own words when possible. The correct answer is option D, record the statement as subjective data in the patient's own words when possible. The patient's reported symptom is subjective data and should be documented accurately for the provider's evaluation. Medical assistants should not diagnose, omit relevant symptoms, or soften documentation in a way that changes the meaning. Question 84. After confirming the patient's identity, a medical assistant needs more detail about a patient's abdominal discomfort before the patient leaves the clinic. Which question uses an open-ended interviewing technique? Option A, is the pain exactly a 5? Option B, can you describe what the discomfort feels like? Option C, you do not have nausea, correct? Option D, does it hurt, yes or no? The correct answer is option B, can you describe what the discomfort feels like? Open-ended questions invite the patient to describe symptoms in their own words and often reveal more complete information. Yes or no prompts, forced ratings, and leading questions limit the response and may miss important details. Question 85. During a geriatric visit, a returning patient is involved when a patient's height is being measured with a stadiometer for a returning patient. Which action supports accuracy? Option A, ask the patient to estimate the height from memory. Option B, measure while the patient is seated in a soft chair. Option C, round every height to the nearest 6 inches. Option D, have the patient remove shoes and stand straight with heels positioned properly. The correct answer is option D, have the patient remove shoes and stand straight with heels positioned properly. Removing shoes and using proper posture on the stadiometer improves measurement accuracy. Sitting in a soft chair, excessive rounding, or relying on memory can produce an inaccurate record. Question 86. During a geriatric visit, a provider asks for an apical radial pulse comparison. Which method is appropriate? Option A, count radial pulse in the morning and apical pulse later. Option B, Have 2 staff members count apical and radial pulses at the same time. Option C, subtract blood pressure from pulse rate. Option D, use pulse oximetry only and skip manual counting. The correct answer is option B. Have 2 staff members count apical and radial pulses at the same time. An apical-radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 87. During a routine office visit, a patient waiting for the provider is involved when a pulse oximetry reading remains very low after the sensor is repositioned before the patient leaves the clinic. Which action should the medical assistant take? Option A, wait until the next appointment to mention it. Option B, report the persistent abnormal reading promptly according to office protocol. Option C, delete the result from the record. Option D, tell the patient the reading is definitely normal. The correct answer is option B. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 88. At a community health clinic, a patient scheduled for a procedure is involved when a patient with shortness of breath is waiting to be evaluated for a patient scheduled for a procedure. Which position may help breathing while waiting? Option A, Fowler position with the head of the bed elevated. Option B, lithotomy position with feet in stirrups. Option C, prone position with the face down. Option D, Trendelenburg position with the head lowered. The correct answer is option A, Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 89. At the front desk handoff, a returning patient is involved when the medical assistant's hands are visibly soiled after cleaning a spill. Which method is preferred? Option A, use hand sanitizer only. Option B, wash with soap and water. Option C, wipe hands on a paper towel. Option D, put on a second pair of gloves over the soil. The correct answer is option B, wash with soap and water. Soap and water are preferred when hands are visibly soiled because mechanical washing removes material. Sanitizer alone, wiping without washing, or covering soil with gloves does not adequately clean the hands. Question 90. During a geriatric visit, a patient with limited mobility is involved when a medical assistant experiences a needle stick while cleaning a room while following standard precautions. Which action should be taken first? Option A, apply lotion and continue rooming patients. Option B, wash the area and report the exposure according to policy. Option C, hide the injury if bleeding stops. Option D, finish all remaining tasks before reporting. The correct answer is option B, wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 91. At the front desk handoff, a patient is suspected of having active tuberculosis for a teen patient. Which precaution is most appropriate? Option A, ask the patient to remove any mask to speak clearly. Option B, use airborne precautions with appropriate respiratory protection. Option C, place the patient in the waiting room until closing. Option D, use only clean gloves. The correct answer is option B, use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 92. During a clinical skills check, a reusable surgical instrument must be free of all microorganisms including spores. Which process is required? Option A, sterilization. Option B, sanitization only. Option C, routine dusting. Option D, plain water rinsing. The correct answer is option A, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 93. In a medical assistant certification review scenario, adult CPR is started according to current basic life support guidance while preparing for provider review. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 1 compression every 5 minutes. Option C, 10 to 20 compressions per minute. Option D, 100 to 120 compressions per minute. The correct answer is option D, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 94. Before documenting in the chart, a teen patient is involved when a disinfectant splashes onto the counter and the medical assistant needs spill guidance for a teen patient. Which resource gives chemical handling information? Option A, growth chart. Option B, insurance aging report. Option C, safety data sheet. Option D, appointment ledger. The correct answer is option C, safety data sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 95. In a medical assistant certification review scenario, a box of supplies must be lifted from the floor while supporting safe patient care. Which technique helps prevent injury? Option A, twist at the waist while lifting. Option B, hold the box far away from the body. Option C, bend at the knees and keep the load close to the body. Option D, lock the knees and lift with the back. The correct answer is option C, bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 96. While following clinic policy, the medical assistant notes that a small blood spill occurs on an exam room floor for a patient with diabetes. Which action should be included? Option A, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option B, ask a visitor to wipe it up. Option C, cover it with paper and leave it for housekeeping tomorrow. Option D, clean it with a dry tissue only. The correct answer is option A, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 97. A provider asks for assistance because an exam room is being disinfected between patients while checking the chart. Which workflow is most appropriate? Option A, use the same wipe until it is visibly dry and dirty. Option B, disinfect only areas the patient mentions touching. Option C, clean from less contaminated areas toward more contaminated areas. Option D is start with the trash and then clean the clean supplies. The correct answer is option C, clean from less contaminated areas toward more contaminated areas. Cleaning from cleaner to dirtier areas helps prevent spreading contamination back onto cleaner surfaces. Starting with trash, overusing wipes, or cleaning only reported contact points leaves avoidable contamination. Question 98. A provider asks for assistance because a coagulation study such as patient or INR is ordered for a patient waiting for the provider. Which tube is typically used? Option A, light blue sodium citrate tube. Option B, yellow acid citrate dextrose tube. Option C, gray sodium fluoride tube. Option D, lavender EDTA tube. The correct answer is option A, light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 99. A provider asks for assistance because a fasting glucose specimen is being collected. Which tube additive is commonly associated with glucose preservation? Option A, sodium citrate in a light blue tube. Option B, sodium fluoride in a gray top tube. Option C, EDTA in a lavender tube. Option D, no additive in a culture bottle. The correct answer is option B, sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose-preserving choice. Question 100. A provider asks for assistance because a tourniquet has been applied while locating a vein before the patient leaves the clinic. Which practice helps prevent hemoconcentration? Option A, leave it on until all paperwork is complete. Option B, apply it over broken skin for grip. Option C, release the tourniquet within about 1 minute when possible. Option D, tighten it after blood begins flowing. The correct answer is option C. Release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen.